All right. Hello, everyone. My name is Kara Schramm, and I manage the AHA Team Training Program. Welcome to this month's AHA Team Training webinar on the mission and vision of an organization, assessments, and actions for deep culture. We have a great speaker today, and before I get to her, I'd just like to go over a few rules of engagement and some announcements. So next slide, please. All right, so you can access audio a few different ways, either through your computer or through your phone. And you can do this by locating the toolbar at the bottom of your screen. And there is a up arrow on the microphone icon where you can switch between computer or phone audio. All the hyperlinks on our presentation today are live, so please keep that in mind during our presentation. And another note, we will be holding a Q&A session at the end of the presentation. So please make sure that if you have any questions for our speaker to submit those in the chat. If you have any questions that are logistical or technical in nature, we will answer those in the moment. A few other notes with Zoom in the chat, you can chat with everybody, you can chat with just us as speakers, or you can chat with somebody individually. So please keep that in mind when you are chatting. All right, next slide, please. We are happy to offer CE credit for our webinars. And so there are a few things that you need to do in order to claim your CE credit. Please create a Duke OneLink account before you leave the webinar today. You only need to do this once, and you can use this for future webinars. My colleague Rachel has put the instructions in the chat. They are also sent to you via email. So please refer to that for more information. Once you register for your OneLink account, you will be asked to text the unique code that you see on the screen to that number after today's webinar. And you have 24 hours to do this, so please keep that in mind. All right, next slide, please. So just a few other notes. We have some upcoming team training events. We are starting to wind down the year with our educational offerings, but we do have an in-person course, a master training course available December 6th through 7th at Tulane in New Orleans. So if you'd like to secure a spot there, please do so as soon as possible. You can find more information on our website as well. Another quick note, we will be offering a virtual master training course, and this is an 8-week course. So if you'd like more information on that, please view our website or look for our email next week with some more information. All right, and then lastly, we do have another webinar coming up. It'll be on November 16th. It'll be with our friends at Relias, and that webinar will really focus on maternal health, specifically VR simulations. So I would definitely recommend registering for that webinar. All right, so next slide, please. I am really excited to introduce you to our speaker today, Heather Slutsky. Heather has come to us before, so you may have recognized her. She was at our Advancing Care Conference, which took place back in March. So I'm going to pass things over to Heather to introduce herself a bit more and get started with today's presentation. Heather, over to you.
All right, thank you very much. I want to thank everybody and welcome you here. I am glad that you had the opportunity today to take a couple of minutes out and hear a couple of new ideas. So one of the things I want to let you know ahead of time is that my slide deck is fairly sparse. So if it is something that you're concerned about, that what you have time to do right now is listen while you work on other things, that's totally okay. You can refer back to the slide deck, but anything that's being said that's crucial will be said out loud. So you don't need to worry about that. The second thing that I want to offer is there is a situation in which this webinar may not be for you. And that would be if it meets these 3 points. The first one is that if your turnover numbers did not change in the next year, would you be content? The second thing is if your patient experience numbers did not change in the next year, would you be content? And the third part of this is if your safety numbers remained the same, would you be content over the next year? If all 3 of those things are true, I may not have anything to add to your current system right now. So you can feel free to take this hour back. If, on the other hand, any of those three things could use some change, the cost of your turnover, the scores that you hear back from your patients, or the safety experiences that they have, I hope that you will have a chance to stay with me and listen as we work through today how mission and vision is different than culture, how you assess and first actions for making your culture a little bit different. One final thing that I would like to offer. These are gentler skills. And so if you are an organization that uses metrics as the first determination about whether or not something can be a project in your organization, this will be tough because this is at the heart of changing the way it feels to be a patient, a visitor, a caregiver, a family member, an employee, a manager, a director, an executive in your organization. These are the skills that add to that experience across the board, whether you are in person or remote. That's what I want to talk about today. If that's not a fit for you, that's fine. I don't want to mislead you into thinking there will be things here for you. I am not going to be able to give you the metric that will shoot to the sky the moment you implement some of these ideas. I want you to know that ahead of time because I believe that is respectful of your time. So what we're going to talk about today is this idea of a gentler cultural lens and what happens when you add that to your organizational toolbox. So we're going to give you some things for Gemba's rounding that you can look for and examine and try and get a better sense of what the people outside of leadership are feeling when they're at work. We're going to talk about the similarities and the differences between the ways that we think about organizational culture and the ways that we think about culture in any other circumstance, whether it is the culture of your identity, the nationality, your personal heritage, any of those things. We talk about culture differently, and then we request from the people around us to engage in it the same way that they always have. The third thing I want to talk about is the ways in which the people who are typically mentioned as informal leaders are actually the reason your organization is the way that it is right now, and the things that you can do that help to change how they interact and to get them maybe a little bit more big picture thinking in the way that they lead from their positions. So that's what we're going to cover today. I hope that you're going to stay with us. I am so glad to be here. Kara and Rachel have been wonderful hosts, and I love working with the American Hospital Association. So let's go ahead and get started. And the way that we are going to do that is we're going to talk about the ways that there are to begin. The two pictures that I have up here on the screen are two different ways to begin. One of them is the way that spring begins, with a bloom that will undoubtedly get covered in snow, but it's still a bloom. It is still the start of the change of seasons. The second way things begin is like Black Friday in the 1990s. As some of you probably witnessed, back in the 20th century, way before the internet, Black Friday brought a lot of energy at very early times of the morning, barging down doors and doing that joyfully, happily, with excitement, because it was a bursting beginning. It was the start of sales and decorations and all that sort of thing. That's not how it feels exactly anymore. But one of the things that I see as being incredibly true when we look at how cultures and organizations exist is that, and I'll use nursing leadership as an example here. Nursing leadership, I have heard in more than one organization say, nurses are super competitive. I offer to you that it's not nurses specifically that are super competitive. It is people who are drawn to nursing leadership who get excited about competing. That if you look at a bedside nurse who has been there for 20 or 30 years, she may be competitive, but probably not in a work scenario. She very much knows what she's doing within her role, and she knows how to move through that. When things change for her, it is not a burst forth into a new initiative and go at it 100% full on. She's still got her brain sheet in her pocket. She's going to take it a little bit slower. They're going to wait and see if it really works because they've been here for 20 years and they've seen things before. For them, change begins like a daffodil. It will absolutely show up. It will be there when you need it to be. And it will also expect to get a little chilly every once in a while. Expect things to regress every once in a while. And that kind of beginning over and over and over makes it harder for people who love a good explosive beginning to know for sure that their actions, that their initiatives are going to be as successful as they hope for. So before we get real deep into anything, I have a poll question for you. And I'm interested in hearing this answer. If you had the chance to see me in March when I was in Chicago, this is going to feel familiar. As a leader in your organization, let's talk about the best meal that your cafeteria serves. So your kind of poll answers here are, I know it, I eat it, and I tell new leaders about it. Second answer, I know what I like there, but I don't particularly like eat the best meal. Like I kind of just eat what I eat. And the third is like, I kind of don't even really eat this food. I've got a box of granola bars on my desk, and that's what I eat. So while you're answering that, I would love it if the chat would put into the chat what your organization's best meal is. And while we're all kind of doing this, I want to tell you a story. It was probably 4 years ago now. My organization had a new leader, and he was new. He was a surprise in the presidency. He was getting oriented, and everybody was coming through a time of kind of surprise change. He'd been there for about 2 weeks. And at that point, I saw him in the hallways, or actually it was in his office, but he was not looking particularly pressed about things. He was just kind of thinking. I tapped on the door and I said, has anybody told you about the grain bowls? And I know that there are a couple of people from my former organization who are here in this presentation right now, and hi. But he kind of looked at me and gave me kind of a weird look and was like, a grain bowl? And I'm like, yes, have you heard about this? And it was something that at the time our cafeteria did on Wednesdays. And it was a bed of lettuce with some like warm, like barley kind of grains and fried chicken, like you could get grilled chicken, but nobody ever did. Mandarin oranges and strawberries and candied almonds and homemade apple dressing that they made on site. And it was divine. It was so good. And in that, the deliciousness of it created a community moment because people would give up pretty much their entire lunch hour to wait in line to get the grain bowl. And so what you had was a not ideally long line that also were people from all disciplines chatting and keeping each other company around this one single food. So I shared all that with him and went on about my day. I didn't take up very much of his time because he was trying to figure out up from down. And about 2 weeks later, he came by and was like, that really was very, very good. And I love that because now he had one tiny snippet beyond the Excel sheets, beyond all of the payroll and the openings and the procedures that we did and all of that sort of stuff. one thing that made that organization exactly and only that organization. You're not going to find that in another hospital. You're not going to find that in another place. There will always be a cardiologist somewhere, but there will be a grain bowl one place. And now he knew where to get it. When we talk about the mission and vision of organizations, we anchor those really deeply to our culture. But that's not the only thing that our culture is. So I see the poll results back, and we're kind of a little bit across the board, which is really nice. I think that that's sincere and honest and truthful. And I encourage the people who know what they like but don't know their best meal. The next time you are out on the floors, that's a really interesting question to ask. When you're talking to frontline staff and trying to have rapport with them, that is one thing that you share in common, where your power gradient doesn't mandate a correct answer. There is no answer to what do you like best from our cafeteria. It's just a thing. Because if you ask them how their day is going, we know what the answer for that is supposed to be. If you ask them if they have any concerns right now, they know pretty much what the answer is supposed to be. If you ask them if they eat at the cafeteria very often and they say, yes, I do every shift, and then you say, so what's the thing that you love to get? They might be opening up the opportunity for you to see a different aspect of your organization. For those of you who don't generally eat the food, totally understand that. It's still an interesting question because there's lots of reasons that you don't eat the food. All of them are valid, but it's an interesting question to hear, what is it that you are missing the opportunity to thank your food service staff for? Because they are building the reputation of your organization. They are building your organizational culture right there. So Kara, can I close this? There we go. Thank you very much. And Kara, is it okay if you come back on camera for a second?
Of course.
I saw that the chat was very busy for food. What are we having for lunch today?
Lots of things: stuffed peppers, meatball stew, desserts, omelet bar,
Yes.
annual holiday meals, pizza, burrito bowls, veggie burgers, you name it.
Awesome. Thank you so much. I'm looking forward to being able to go back through the chat afterwards to take a look at that other stuff. Thank you, Kara. Okay, so talked a little bit about mission and vision. Let's talk now about what the universal components of culture are. This is a partial list from Dr. Gilo Kwesi-Logan about the things that happen in culture. And this is much more around your heritage, your identity, culture, those sorts of things. The components of that, which are met to create a culture. So a lot of these transfer towards organizational culture pretty easily. But I want to go into depth on a couple of them. So first, geography. Okay, we have a similarity in geography because the people who work here are only as good as the commute will allow them to be. Like that is your binding thing there. And from a geography standpoint, you have the community that you serve. My question for you here as an action point is, what are the 2 or 3 easiest ways for your community to say thank you? What is it that you offer with ease to the community that allows them the chance to show their gratitude? I'd like you to think about that a little bit. If you have things that you really love that you would like to put in the chat, I love it when the chat becomes a like big bank of knowledge. So feel free to add those. So second one, language. Here is a thing for those of you who work in patient experience primarily or have oversight over patient experience. One of the most fascinating things I ever had the opportunity to do was to bring out a world atlas to my interpreters. My department at that time had people from 7 different countries interpreting Spanish, and I learned a lot about interpretation through them. What was even more interesting to me was putting a pin in that atlas, not only for every country that my department had come from, but also every language that we knowingly provided interpretation services for electronically. Because that's when you start to see that your idea of a homogeneous or bilingual 1, 2, maybe 3 languages in your community, that illusion shatters the minute that you start putting a pin in every time you get an interpreter in a different language. Your culture, your organizational culture, more and more is influenced by the demand, the respect shown, and the ways that you deliver interpretation services. The third thing on this list, food, clothing, transportation, and shelter. We talked a little bit about food here. The idea of food being a central tenet in the way you describe the culture of your organization works all over the place. Because when you think about how you describe where it is, like the food of your heritage, that is where there are stories, there is comfort, there is community. Gathering around food is one of the things that human beings are absolutely best at. And so your food service folks are a harbinger of your culture. Are you letting them shine? Are you letting them express the organization, the variety of people who are there through what it is that they serve, how they serve it, all of those sorts of things? There are always financial barriers to doing what we want to do. And we have all heard variations of the story of the little old grandmother who was in the hospital and failing to thrive, and people kept on bringing food over and over and over to them to try and get her to eat. And in the end, like, people would like bring chicken soup because chicken soup feels and is completely universal. But when it's congee, the rice has been cooked to like mush and there's not noodles. When it's pho, it's long, thin rice noodles and hot sauce. Every culture has a chicken soup. Not every chicken soup is Campbell's. And so when you allow your food service folks to shine through, you could have an entire month in your cafeteria, flu season perhaps, that is just chicken soups from around the world, because we have that commonality and those small distinctions which make each of those heritage-based cultures shine. Economics. I don't need answers to this one in the chat, but here's my question for you to consider about the economic culture that you create. Does everybody in your organization make enough money to work one full-time job and live by themselves? Not in luxury, but someplace safe. And if they do that with the benefit of state aid, what are you valuing in your own organizational culture? Because what you want is people to come to love being in your organization and to be able to stay there for a long time. And if a person could not be single and living by themselves and working in your organization without the help of federal assistance or state aid, then you are creating a culture that says, I don't worry about your safety. I don't worry about your health. So I'd like you to consider that. Education and technology. These are two things that is so interesting in healthcare because the bar keeps raising and shifting. With that, you have the ability to look at how you feel about education, how you feel about the way that you roll out technology. Let's take, for example, for education. So there are two kinds of student loan debt relief happening right now. One of them is the $10,000 or $20,000 kind of just. The second one is for people who are leading in nonprofit organizations to help their former students, now employees, get relief through the Public Service Loan Forgiveness Program, which is 10 years worth of making on-time payments and documenting every year that you've been working full-time to get some of that loan debt relieved. Got to be a nonprofit to do it. For-profit hospitals, in all of the time that I have worked in nonprofit organizations, I have never seen the public relations group, the administration, my personal leadership take the time to be like, hey, student loans, if you have them, give me this piece of paper and we will get this ball rolling. If you're thinking about the benefits that your people need so that they can stay members of your community, so that they can be financially sound and safe, so that they can do all of those things, the fact that your organization is capable of helping remove tens of thousands of dollars of student loan debt is of value. It doesn't originate from you, but it's not possible without you. And so taking the time to help people understand how to do that is good business. Because if their debt is worked off through their service to the public via your organization, they have safer lives, they have more affluent lives, they need less in pay raises and that sort of thing. You can take all of that bounty just by helping them understand about programs that are available. Cultural expression, values, beliefs, and rituals. I celebrate a holiday called Candle Time. It was made up by a woman on the internet a decade ago. Candle Time is organized by lighting a candle and drinking a beverage you like every day from November 1st to the Wednesday before Thanksgiving. Part meditation, part slowing down, part, just relief from the rattle of the world, part shoring up your experiences so that you can be ready for the Black Friday release. The way that we express our values, beliefs, and through ritual, the way that we celebrate things matters far more than we understand. As organizational leaders, it gets easy to think that we have like the key, the solution for how to build celebrations that our folks would like. But we don't build those celebrations the way that we would build the things that we did at home when we were moving for a specific feeling. And we're going to talk about that a little bit more. So you're thinking about all of the things that create culture where you are, not the mission and vision, because those are things that are frankly pretty similar across the nation. The vision, the mission of most healthcare agencies is to do some version of making the people who live near us healthier and happier. Everybody puts different words to it, but that's pretty much where we're all headed. Where you get a green bowl or an omelet bar, those are different. And so your culture is different. You start thinking about these soft things. How is it that we celebrate things? How do we share a day of mourning? Because when I think about what it is specifically for bedside folks right now, this is less true for the leaders who work further away from bedside. But what I have seen in 20 years of working in healthcare in all kinds of varieties is it is very much like walking into a bookstore, standing in the fiction section, opening up a dozen books to the back third somewhere, reading a couple of pages of like the fight scene, the climax, the profession of love, all of those things, and then just walking away. We ask healthcare leaders, we ask frontline folks over and over and over to be there for a moment of somebody's story and never see the end of it. And in those rituals and celebrations that we think about, we have got to look for ways to close those chapters. It goes back to my question about what is it that you do that allows the community to say thank you? Because your nurses, your physicians, your CNAs, your respiratory therapists, especially in the last few years, see these snippets of people's stories and they never get to see the loop close. So what do you do that helps to close that loop? So you're thinking about all of these kind of gentler versions of culture, the things that equate to culture outside of formal organizational culture. You're thinking about food, you're thinking about what things look like, you're thinking about how things feel. So let's go on a Gemba. Let's walk through your organization shoulder to shoulder. And here's what we're doing. We're looking at the walls and halls, because that is a tremendously important part of what it feels like to be where you are. One of the things that I see being true of nursing culture, and I don't know that it is as healthy as it started out being. And I will put part of that to the last few years, but even before that, you see in the image on this slide, you see these decorated wine bottles that are labeled for the Etsy shop that sells them as perfect gifts for nurses. And it's funny. It is absolutely funny. It's clever, all of that sort of stuff. And one of the bottles, for those of you who are primarily just listening, says, "Open after patients. It's a mental health break." We know that addiction and substance abuse within healthcare continues to be a challenge. And so as you are walking through walls and halls, look to see if the things that you see support healthy existences. So peer-to-peer messaging, couple of different versions of that. One of those things are the kinds of thank yous and good catches and that sort of thing that happen as a peer-to-peer acknowledgement of a good experience. I saw Jason do a great job with this elderly man. He was awesome. You see that sort of thing. I love those because that, from a safety perspective, from a reliable care perspective, from a patient experience perspective, everybody thrives with sincere acknowledgement of the things that they're doing really well. If what you're trying to build is a safe, kind, reliable organization, having those places where peer-to-peer, you can say, yes, absolutely, nailed it, good job. That helps the staff float lighter on days that are hard because they know that they are seen as the professionals that they are. One of the other things you will see, though, is peer-to-peer messaging, which is sarcastic. Everything that involves a wine glass, everything that says, I nurse, therefore I drink. All of that sort of stuff, all of the tangential kind of, it's not this department, it's that department, that peer-to-peer discomfort with each other and the discomfort with knowing how to process the things that are hard. Because as individuals, as an organization, they don't have a method to let go of the things that hurt. And so they subsume them through dark humor, which we all need, sarcasm, which we all need, alcohol, which some of us enjoy. But still, when you see lots of sarcastic messaging around, what you see is a group that is in pain and doesn't have a way to process it. So that's peer-to-peer stuff. Leader to staff messaging is interesting. One of the things I talked about when I got to meet some of you in March was what each of you did. And Kara, I'm going to ask for your help in the chat again with this one, so I can warn you this time. I'm going to ask you to put this in the chat. Let's say you get one of those beautiful little note cards organizationally that says, thank you so much. My mom was there. Da, 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 da. We loved everything. Thank you so much. I would like you to add into the chat how many people get access to those words of praise after you get that recognition. So what is the system in which somebody receives one of those cards or receives an email of gratitude? What kind of spread does that get? I can see Kara's eyes moving very, very quickly, which is cool.
Okay. We've got some chats coming through. Very little spread. I don't know, not me. We have a kudos system. Goes to our page, our unit, share in a safety huddle, the staff involved. Let's see here, newsletter.
And what I hear from that primarily is that even if this patient had been through a tremendously long cycle of care and had dozens of people make contact with them, be part of this incredible experience, most of those people will never know it. The food service people, the EVS people, everybody that went through their room won't know it. And so from a culture perspective, we are missing the opportunity to make sure that the people who created gratitude in this person get to know that they had that impact. We miss the opportunity to see that people who are kind of on the fence about whatever your experience initiative is, whatever your safety initiative is, are not seeing day after day after day that their colleagues are creating these moments for people which are deeply meaningful and will be treasured forever. I look back, I was widowed, it'll be 21 years in January. I was widowed a very long time ago. And Terry, who was a nurse, who was also my husband's surgeon's mobile social skills, because he was not real big on the whole social skills thing, at one point pulled me aside and said something that saw me to the heart of me as somebody who was 27, 28 years old on the brink of losing her husband. And she saw me in a way that I will never, ever forget. I told her that at the time. I told her that afterwards. And I hope that the people I didn't tell, who were also part of that, somehow just magically knew. For all of you who have been patients, who have been family members, especially when it's outside of your organization, you know the ache of wanting to share that gratitude and not being entirely sure how. So, leader to staff messaging. Are you sharing that gratitude? Are you consistently, constantly, repeatedly connecting positive outcomes to the work these people do? Are you closing the loop in that book that they have opened and been like, yep, you read the chapter where there was the car crash and they had no idea what was happening. And now we know for sure that they are back to work and they did make it to their son's wedding because they told us and we told you. The other thing that can show up as you look at the walls and halls of your organization is leader to staff messaging, which is tricky because it is demanding. It is emphatic. And as leaders, we have to set expectation. No doubt about it. No doubt about it at all. And we also have to do that in a way that is respectful and responsive to the level of responsibility we see within our staff. And we're going to talk about that just a little bit more in a minute. And finally, organization to public messaging. One of the last places that your culture shows up is in the way you talk to the community that you serve. Not just in the pictures that you show, but how often you talk to them about what it means for you to be in community and in relationship with them. Not as PR, but just as people in the world. So I want you to give that a little bit of thought. So let's say you walk through the halls and walls. You look at the halls, look at the hallways, look at the walls, look at the doorways. And you're not sure that if your own home was treated the way these spaces were, that would create a place where you felt respected, where you felt safe, where you felt trusted, where you felt confident. You look at these spaces and you're not quite sure anymore. I'll give you two real quick examples of specific places that I would like you to look at the next time you have the opportunity. Go to a nursing unit. Go to food service. I know I feel really focused on food service right now, but I had a really good lunch right before we started all of this because I'm out on the East Coast. And apparently it's just sticking with me right now. So look at the time clock and read the things around that time clock and assess what the energy is that gives off. Are you messaging, if you don't clock in on time, I'm going to fire you? If you don't sign up for the potluck by Thursday, you don't get anything to eat. If you don't start changing the way your badge holder is worn, even though they all constantly flip over because that's what they do, we're gonna penalize you for that. Or is it the patient made it to their son's wedding? We're thank you for this. This is the space where we set the tone, not specifically for you to leave work, but for you to go home. The other place I want you to look, because you're missing an opportunity, I bet almost all of you are. If you have a specific door that the majority of your employees go through in terms of getting ready to leave at the end of the day, is that wall painted beige or gray? Gray is another option. Sometimes kind of a nice light blue. Can you get your foundation, get your favorite donor who cares about how much your staff has given to the community and say, we want a mural. We want a mural that invites our staff to go home with peace, with our admiration, with all of the things that we want them to feel as they go home. And we want to make a mural of that. Now, granted, after a while, people will go kind of blind to it. Yeah. But what will happen first, if it is filled with the outdoor scene where everybody hikes in your area, or if it has a picture of the lake, whatever the lake is, you are acknowledging that there is a huge time in their life and in yours where you are not at work, where you are your other selves, and welcoming them into that rest. It is hard right now to figure out how exactly to build teams that are online and to come back to whatever we're going to be now as hospital systems, as physicians' offices, as people in the world, and figuring out what that's going to be. Part of that is thinking about what it is that we want people to feel so that they can be productive in the ways we need them to be when we need them to be. So, actions you take after you look at the halls and walls. You defend the rest spaces. I completely understand that it is possible to put stuff on the back door of a bathroom stall because people are a trapped audience and have to read it. And maybe sometimes we just want to pee. So defend rest spaces. And it includes taking stuff down that's out of date. It includes a tremendous amount of stuff. But let rest spaces be for rest. One and done messaging when appropriate. So this is the slide that has all of my biggest ideas and all of the things which I think will truly start to shift what your organization, the people who make your organization. Because don't forget, there is no such thing as a compassionate organization. There are compassionate people that work in your organization. And that compassion is not limitless. It must be replenished. So here's what I want to suggest for some of that sort of thing. One and done messaging when appropriate. To the degree that you are absolutely in control of a messaging. This is going to work best for people who are online, who are unit managers or directors of a fairly modest scope, to be able to pick the things which only will get messaged to the team once. With the team, you decide what that one message will look like. Maybe it's on the wall, maybe it's an email, maybe it's skywriting, whatever it is that will work for your group of people who are active participants in this. And then for things where you are 100% in control of it, you go ahead, one and done. I know there are the PRN people who only work there once every 6 weeks. They still know where to find the one and done messaging, because there is a discord that we offer to our employees when we say we trust you implicitly to keep these people alive, and we do not trust you to remember to sign up for the potluck. You've got to go ahead and give them, I'm capable of saving a life trust, even when you're talking about macaroni and cheese. So where you can, identify places you can do one and done messaging. Start small and start only with the things that you have absolute control over. Second, bigger idea. Take the budget, the organizational budget for holidays, and split it. For things that occur on a calendar that everybody celebrates regardless of whether or not they work at the organization. Memorial Day, Labor Day, anything that happens in December, all of that sort of stuff. Give a chunk of the budget to frontline staff and let them manage that. Little team, task force, coordination committee group. Let them do that. Leadership, creates the celebrations that are only and exactly capable of happening because you work here. Whether you celebrate Founders Day or fiscal New Year's, or you create an anniversary celebration for when you merged into another system. There are days worth celebrating that are specific exactly to your organization. It is where you build in community feedback. It is where you hear about the lives that you've changed. It is where you increase people's comfort and dedication to your organization, because only you do that. And fiscal New Year, I will tell you what, I was amazed to recognize how many people, and I shouldn't be, how many people don't have a working understanding of what a business fiscal year is, how that is parallel and is not parallel to personal budgeting. Like, if you want to make your folks happier, they need to understand why it is that you simultaneously are not filling this empty position and building this new wing. It took a long time and a lot of effort for me to be able to explain to my staff this part, why this job is going to go unfilled indefinitely, and why there were cranes that cost $1 jillion a day outside. Because if we don't ever tell people how that works, it only makes sense that they are frustrated when it happens, because it seems so incongruous. Finally, this is the tough one. This is the tough one. I want you to take your end of the year meal and move it to the second week in November. And here's why. First, go have your food guys price. If they were going to serve tomorrow what they will serve in the middle of December, go price that and see if there's price difference, because there's going to be. Because there's middle of December, we all want shrimp and cheesecake, and it's priced accordingly. It's priced like roses in February. But if you move it to the second week in November, then all of the other things that crowd their life are never in conflict with an opportunity to be in community with their colleagues. They never have to look at their child and say, this feels like a command performance at work, and I know it's your recital that night. Just scoot it. Leave way for the people on the committees who are doing the calendar-based events to do something fun at the end of the year that is or is not tied to a specific holiday. I recognize, having glanced at my watch, that I am talking longer than I thought I was going to. So, more on the what and how. As we celebrate, you want to start with the emotion you want people to feel and build out from there. One of the things, a couple of the things that really impact this are remembering that changing the lights are going to be more effective than corporate colored balloons. Like, just bring some like nice lamps in, and don't use the overhead fluorescent lights. You change the whole mood of your most used conference room. Be mindful of what's happening in the communities that you serve. This is like the local half marathon, the local carnival, all of that sort of stuff. If we are remembering and actively engaging with the fact that we want people to go home and be home, then we have to know and recognize that there's stuff happening out there that will conflict with their ability to work with us. And finally, and this goes back to those inherent parts of culture, rituals exist for sadness too. We do our employees a disservice when we don't give them a way to stand in community and grieve all of the things that we lose. Pretending like it's okay, moving on quickly, fast and forward, that's competitive leadership. And it's interesting and it works for a lot of people, but there are some people who need to process that heartbreak in community and won't have the chance to. Kara, can you come back on camera for me, please?
Yes.
I recognize that my timing got all off here, and I apologize for that. I apologize to everybody who's here. But I really love thinking about celebration and community building. What I would like to do here is it's more important to me to offer a chance for questions than it is to talk about the gradual and steep leadership growth. So if we have questions and it's okay with you, I would rather just cut to that.
Yeah, of course. We do have a few questions, so I am happy to kind of read off some of those just for the sake of time. So let's start with, how does this sort of soft culture relate to teams that are working from home or in a hybrid environment?
So what I think is really beautiful right now, especially with folks who are working in a hybrid or an online environment, is that those component parts of culture can be part of it. But I think at a big level, healthcare is working to figure out what that culture should feel like. And so it is a tremendous opportunity for you to dig really deeply into why working at home is good, if there are things they miss about being in office, and the things that you can do online or in office in a hybrid situation that will support a feeling of togetherness, with the caveat that making that mandatory outings when part of the reason people want to stay at home is because they are still taking care of or are themselves immunocompromised still, but you get to be the leader right now in that creative thinking around what culture can look like if it doesn't involve being in person.
Great. Thanks for that. And I am kind of watching the chat here. I think we have time for one more question, but before I get to that, do you mind going to the slide with the final reminders? I would love to make sure that our attendees just have another reminder of our continuing education credit. All right, so the question that really has been coming through the chat over the last few minutes is just some more information about the one and done messaging. Do you mind elaborating on that concept just a bit more?
Oh, okay. I would love to. All right. So we'll use the potluck as the easiest example. Your department is going to have a potluck. If you can, go back in your old email messages and just find out how many times somebody sent an email of some sort around that. What you want to do instead is you want to build a reliable system in your department for where those types of messages are going to happen. Like I said, start out small to begin with, like make it non-mission critical stuff. This is not the time to talk about the annual CBT and that sort of thing. Start out small and build faith in that system, because there's going to come a moment where you want to be like, maybe just one more email about the potluck. People told you what they meant when they didn't sign up. You can bully them into it. You can nag them into it. But when your folks are excited about an event, they will respond, especially when they trust that you've told them about it and now it's on them to remember and to take action. There's a bunch of ways that you can do this. It can be, if you're doing it in email, I recommend having part of the subject line be like, one and done, potluck next Thursday. Because then for people who are PRN, for people who are out on maternity leave or parental leave of some sort, FMLA, when they come back in and they have got 877 different messages, they can sort by one and done and know that those are the things that this is the only time I'm going to see anything about them. You've got to be completely in control of the messaging, because if it is something that like PR is helping with, they're going to take a rhythm to it until one and done is proven in your organization.
Great. Thank you for that. I think that'll clear up a lot of questions that were coming through the chat. But if there are
and I'm happy to answer other questions about that offline. People can feel free to reach out to me. I love working in that way, because nobody wants more emails in their life. And they certainly don't want repetitive ones. And that helps that cycle of respect where you do one and done. and then it is, decreases the amount of emails you get and helps those emails you do get read more clearly. Okay, sorry.
You're fine, thank you. If there are other questions, we will follow up with some information on how to get in contact with Heather. But again, thank you all for attending today's webinar. Please take the evaluation once you leave this Zoom meeting, and don't forget to fill out your Duke OneLink account information and text the SMS code. But
And
thanks
as you
again.
fill out your survey, just as a brief reminder, I didn't get a chance to tell you, your hair looks very good today. And I think that's a new shirt. You're looking very nice.
Thank you all. Have a good one.